I'm Dr. Michael Miyasaki, and today we're going to do a program on dental photography. Dental photography and imaging, depending on how you do it in your office, I just think it is needed today to elevate your practice, and that visual excellence is around us everywhere. So that's what we're going to talk about today, and I hope you understand the importance of this. The last week, I've given this presentation a couple times to different groups. And I'm always amazed at how so many dentists or clinicians in general, they could be front office, back office, just aren't involved in doing any type of dental photography. And dental photography today is, I think, critical in how we build our practices. And I'm going to show you that in just a couple slides here. So this came through this last week, and it's just from our ADA. And it says, according to the ADA, the Q4 2025, the reimbursement rates are not keeping track, or the reimbursement rates of the dental insurance companies is not keeping pace with overall inflation and our practice expenses, and that is putting a significant financial squeeze on dental practices. Like it's been doing this for the last 20 years, but it's good to see it in print or at least online. So my feeling about this is that we need photography and imaging to market our practices, to brand our practices, to document medical legal, to increase patient education, to increase the awareness of the services we provide, and all this will build value. So I was speaking to a group earlier this week, and in that group there were some very well-seasoned dentists, and there were some pre-dental um, participants in our audience. And I was telling even those that haven't started dental school or the ones that were in dental school that it's very important to start to document your work. Why is that? Because if you're going to be graduating from dental school, and we get this all the time, somebody comes into our practice and they want a job, an associate job, and it's very nice when they have a portfolio of their work so they can show us what they've been doing. One, I admire if they do take the time to photograph the work. If the work looks great, hey, that's even better. But knowing that they're new at dentistry, I'm not expecting perfection in the work, but it's just nice to see that they're taking the time to document, because those that take the time to document typically are on a track to get better at dentistry. So remember when this was our digital dentistry, our photos in dentistry. We had a little film that was about an inch and a half by an inch, and we had to interpret that and try to show our patients, if we wanted to, what their X-rays look like on a film. Today it's changed dramatically because we've got everything digitized. So one of the important things with photography is just lab communication. When we want to match shades, get accurate shades, texture, translucency, it's really hard to describe that on a piece of paper, a lab slip. And it's just so much easier to do it by sending the laboratory photos. So I send my laboratory photos all the time. If we are trying to do a case where we can adjust the midlines, or the position of the midline, or the angulation of the midline, or the occlusal plane, and we're going to move gingival zenus, it's always nice before we do an aesthetic case to let the lab know that we want to make these changes, that we're going to be doing some laser gingivectomies to raise the tissue up on teeth. And by having better communication, it results in fewer remakes, I think nicer restorations, and happier labs, happier patients, and happier clinicians. So a good photo can replace thousands of words and several phone calls, and so it really simplifies our work. This is a case I was working on last week where we are working on the front three teeth, the right lateral, right central, and left central. And so we're going to change the shades because you can see that these teeth have all kinds of different shades. So I take photos of the different shade tabs that I want to incorporate in the color. So we're not going to have monochromatic crowns or veneers. We're going to mix the colors together. A little bit of gingival warmth, a little bit lighter mid-body, and some incisal translucency. And it's just really a lot easier if I can describe this in photos than trying to write this down. I mean, I don't know a way that I could write down that you see the left lateral is a lot lighter, maybe not as wide as a BL1, but much lighter than a B1. So we need to mix the colors to get somewhere in between that. We've got craze lines, we've got surface texture. How would I describe that in words? For me, it would be very difficult. Now, here's a shade tab photo. You can see I got the shade tab, and that shade tab matches the central's pretty good. But the problem with this is that the lab looking at that doesn't know what shade that tab is because we've cut off the designation of whatever that shade tab was. When I start to rough the preps out, I'm going to grab a photo of the prep shades so the lab knows what color we have to block out. So I would typically have a shade tab here, and just like we did in the other photos, so the lab would know that, hey, maybe this is an A3 prep shade. And so they would know if we wanted a BL1 or a very bright veneer or crown, how much opaqueness they have to have depending on, again, on the depth of our preparations. And then we just got done doing a live patient course. And one of the things that we use in our live patient course is a Cois dental facial analyzer. And that is to tell us what the occlusal plane is, both from lateral and front to back. And we line this up, the vertical stick's going straight up and down the patient's face. And by going straight up and down the patient's face, the plate goes perpendicular to that. And we automatically get the correct horizontal plane. So we use this, but we take a photo of it because sometimes when we have the full face photo here, that if the analyzer is canted, the lab can correct because they can tell from our photos how much we're off. The visual photos provide proof to the patients of what we're trying to describe to them. Again, it's very hard to do in words, and I think that builds trust. So patients believe what they can see. It turns an abstract diagnosis, something that's very hard for them to understand. And it doesn't have to be that hard, but patients, just like we were before we became dental clinicians, if somebody said, well, you've got a filling or you've got a cavity in that tooth or you've got plaque around that tooth, we don't really understand what that means. But when we see the hole with the photo, then we know, okay, we need to do something about that. So we go from an abstract diagnosis, you've got a hole in your tooth or a cavity, into something that they can understand, and that convinces the patient, so they trust us. It builds emotional engagement because now they're involved. They see without any pressure. I'm not saying you have to do the filling, but there is a hole there, and it's probably going to get worse, and you could end up needing a root canal or maybe having a lot of pain or maybe even pulling that tooth out. So what the photos do is it removes the salesy side of what we do, right? And it just replaces it with, let me help you understand the condition of your teeth and what we could do to improve that. So this patient, comes in, and a lot of times for our intake forms, we ask the patient, do you like your smile? Is there things you don't like? Are your teeth crooked? Are there restorations you don't like to look at? And a lot of times the patients will say, no, I'm good with everything. And then we take a look in their mouth and we go, wow, it doesn't look ideal. Maybe they're not having any discomfort or anything like that, but we could do a lot to improve this smile. So you put that up on your monitor and just ask the patient, what do you see here? Or if they do have some concerns, what concerns do you have? And they start to point out the dark fillings in between the two front teeth, or maybe the ones next to that, and how the teeth are chipping and that gray at the biting edge. And so the patient understands that tooth's starting to get really thin there, and they can see right through the tooth. And that photo's there. So if they come in saying, well, I don't have any problems, then you can start pointing out, well, look at the wear and tear that you have on these side teeth. They're really pointy because you're wearing them down. These brown spots or orange spots in between the teeth, those are old fillings that are starting to break down. And before you start to have any type of pain from that, we'd like to go in there and replace them. Maybe you want to do an aesthetic makeover and make your teeth brighter. So we can show that to the patients, what it is that we would like to improve. And then when it comes to case planning or maybe planning with another clinician even, it's really nice to have photos because we can do our smile design without the patient being there. If we have to look at the occlusion, we can look at the occlusal photos and see where the wear and tear is. And it's always nice to be able to see kind of the before and afters of when we see the patient perform any kind of treatment, and then how they end up. So photography allows us to kind of think on the screen, because once the patient's gone, I forget exactly how the teeth looked, but I can always look back at my photos and look at the dentition, cervical lesions, whatever it may be, and it really makes our job much easier having these photos. Look at a case like this. You've got a lot of wear and tear on the occlusal surfaces. So how are you going to treat that patient? And I just did a webinar with another doctor last week saying, some of us would look at this and say, well, I don't see really anything wrong. Others of us would look at this saying, well, we're losing a lot of our occlusal surfaces, so we must be losing our vertical dimension, which is causing our condyles to reposition, which means this patient's becoming more likely to have a TMD or issue or an airway issue. So it depends on where you are and what you see. But if I was going to treatment plan this, I might treatment plan them for onlays, conservative onlays, just to protect the occlusal surfaces of these teeth, restore some of the vertical dimension, have to do very little preparation of the teeth. And if that's the case, I could show the patient what's going on. And if the patient said, at this time, I really don't want to do a lot of work, I'd say that's fine. We could look at other options. We could do composites to hopefully slow the wear down, or maybe do nothing. And the patients will be able to see these photos today and see the photos next year and the photos the year after that. And if we see a progression in the wear and tear, hopefully the patients will understand why we made the original recommendation. I think for professional growth and self-coaching, you can see details that sometimes we miss clinically. A lot of times I will look at photos after the patient's gone and we've done our comprehensive examination, and then I look at the photos and go, oh, I missed this, or maybe there was a little recession around a tooth. So it really helps me, puts me back in to where I was when the patient was in the office, but then I can see things much clearer because I'm looking straight on. I don't have lips in the way. I don't have saliva all over. I don't have the patient talking or moving. It just makes it so much easier. A lot of times what I'll do is before I do a large case, I will actually look at the photos and the models to figure out what kind of preps I'm going to do in the patient's mouth, where the margins are going to be, how we're going to adjust the contours. And it helps me professionally get better and better. And photography is a way to get better because a lot of times when we have a case, we might remember where we started, we might see the end, but I'll tell you, it's hard for us even to connect the journey on that case because many times there's 2 to 3 or maybe weeks or maybe 2 to 3 months or maybe 2 or 3 years from start to finish. And so by having the photos, it actually helps me as a clinician get better. And these are some photos. We're trying to restore tooth number 9 or the 2-1, and you can see that that's a restoration. The shade's not quite right. The transitional line angles aren't quite right. And to be able to take a picture of that and send that to a lab and say, okay, these are the corrections we want to make. The surface texture is not too bad, which we see on the off-angle photo on the far right, but there's a lot of things that we can still improve. The value of this restoration we have to improve. This is a case we're getting ready to do, and so we have the before photos, and I've got my shade tab, so I'm beginning to communicate to the laboratory how I want to change the shape, the contours, the margins, and how we're going to come up with a very nice shade. This was a case I did last week where these class 5 lesions are actually some in the posterior and there were the anterior, the right central, the left central, and the left lateral. And so in these cases, you get in there and gently air braid the tissue, place your composites, which you see on the right-hand side. And when I got done with this, I had the pictures on my photos and I showed the patients. Here's where we started. There was this discoloration and this roughness right at the gum line of these teeth, and now we've restored that. And this is the immediate post-op that you see on the right-hand side. It's going to look much better once the tissues heal up. But the patient was amazed. So they went from having these grooves that they didn't like the appearance of, and they could tell how rough they were. We restored them very comfortably with air particle abrasion and then gave them a very aesthetic result. The other thing that these photos help with today is just our marketing and practice growth. We get a lot of calls from patients saying, I'm interested in aesthetic work. Can you let me see some befores and afters? And I'll tell you, I'm really bad at this. I don't post everything on my website. So we can send our patients before and afters, or while they're in our office for a consultation, we can show them before and afters. Social media, websites, you can use it for lectures if you're speaking to some of your peers. And it's really authentic marketing because it's not really marketing in a salesy way, but we're doing it with the intent to help our customers achieve what they want to achieve through education. Let me show you what's possible. Let me show you what we've done. And through that, the patients can then process and make decisions on their own. And it really attracts those patients who value quality. And if we're doing imaging, as we spoke about, so they can see where the biofilm is it helps them value prevention. So a key idea here is that the best marketing is just really honest documentation. Let me show you the condition of your teeth. Let me take a picture. Let me put that picture on a monitor and we can look at it together. What do you see? What would you like to do? And I think that is a nice way to handle this. Research shows that if we have photography, it can increase our case acceptance by 30%. Now, of course, it depends on how well we are doing, but if we're kind of on an average on our case acceptance, again, having an image is really nice to show the patient what's going on. and having an image maybe of a past patient we treated that had a similar issue, this is what we could do, and the patient is more likely to proceed. When it comes down to social media, if I put a picture on Instagram of myself talking about a procedure, I might get one or two views. If I have photos of befores and afters that are HIPAA compliant and I put those up there, everybody wants to see a before and after, right? And that will increase the engagement of our social media content. And I will tell you, patients love to see this type of work in your office, whether you have it on your walls. These are some slides that we have on our monitors. So while the patient's sitting there, if we ever leave them for 5 minutes or they're resting when they get there, these are the slides that kind of go through it. And I just put up photos of cases I've taken. So this is a slide that would show up on the monitor. On the left-hand side, you see an old filling, you see an area of decay, and then on the right-hand side, you see how we've used bioactive materials that will help the tooth regenerate itself. It's much nicer. Here's an area where we're just showing patients what dental implants can do for them. So if they get a dental implant, we show them how that's a metal implant that's placed in the bone and on the gums, and when it's restored, how it can look aesthetic and it can function normally. But what it's going to do is it's going to give them a lot more confidence because they can chew better, they can speak better. It's going to be, that's the value. A lot of patients have these old crowns, and so we have photos of old crowns and what we can do when we go to ceramic restorations. It makes the gums look healthier, it makes the teeth look healthier, it makes the patients look younger and more youthful. We show them what porcelain veneers could look like, how natural they can be. And photos like this, some patients may not like the gray, the incisal translucency, but this photo creates a option for us then to discuss that. Do you like that gray? That gray is kind of what's built into natural teeth oftentimes because that's for the teeth that are thinner. But if you don't like that, we don't have to have that there. And then we just show the patients how when we combine everything together, how the before and after can be very life changing. So our patients like to see this. Now, when it comes to capturing these images, what do we use? Well, the camera on the far left-hand side, that used to be a really easy one. We bought that for about $600. It actually did have a ring flash around that lens. Middle one, a DSLR is typically what I'm using today. I've had them. I got my first 35 millimeter camera set up similar to this when I was in dental school. So I've been doing this for over 40 years. Now we have the digital cameras and they work very well. On the far right hand side, on the bottom, you have Shofu's Eye Special. It's kind of a point and shoot made to be very easy for a team to use. And then I will tell you, I really like cell phones, whether it be an iPhone or, many of the phones today have great cameras on them. And I'm starting to use that even more. I've spoken to you about the two cameras on the far left-hand side. Those are the Q Bliss Suite cameras, the Cam and the Pen, and those are the ones I use to show the patients the biofilm. Those have proven to be very effective in our practice. And on the far right-hand side, I have 3 of these camera bodies, one with the ring flash that you see kind of in the center of that right-hand frame, and then on the camera setup on the far right-hand side, that's 2 point flashes. And then I typically will have a third camera body just for portraits. So I don't like to switch out the lenses. I just have 3 different camera bodies. And this is a setup that I'll use for portraits. We have 2 soft boxes that come in at about 45-degree angles to the patient. You can have straight on. You can have the patient turn the head, get different effects. But just showing how it can make even somebody like myself look better, right? Even lighting. Just showing you a close-up. I used a skull just so you can see how it illuminates the teeth. And you can get some really nice photos with this with a really easy setup. The photo that you see of me on the far left-hand side and all the other photos on this page were taken with my iPhone using the softbox lighting. So let me just explain some of the technical issues, because if you have a phone, whether it be an Nikon, Canon, Sony, whatever it may be, you've got these settings on these cameras where you can put them in a manual setting. But when you have them in manual setting, you'll have your shutter speed, you'll have your aperture, and you'll have your what you call the ISO. So it's called the triad. The camera flash, when you see TTL, that just means through the lens metering. So it will adjust for the light, often when you have it set up in a program mode. So there's this exposure triangle. It's called ISO, which the ISO, the higher the number, it means your sensor, used to be the old time film, was more sensitive to light. The problem with that is with the old time film, the higher the number was, it'd be more sensitive to light, but your images would be grainier. Shutter speed is how fast the camera actually opens and closes and allows the light in. A slower, longer shutter speed will let more light in because it's going to open up, let the light in, and then close up. The problem with that, though, is if your camera is moving while that shutter is open, your images are going to be more blurry. The aperture is the actual lens size. So how big does the lens open up? Sometimes it'll open up and be a small hole of light, and sometimes it'll open up and be a large hole. Now this is where it gets kind of confusing because f-stops are inverse numbers. So when you see an f-stop of, let's say, 4, that means the camera is open to allow a lot of light in, but it's a small number. If you have an f-stop of, let's say, 32 or 29, that means that the aperture is opening just a very small bit, so it's going to be smaller. Why is that? Because it's 1 over 4 or 1 over 32. So now the number, even though it's bigger, the denominator is the bigger number now, but under 1, so the total number is smaller. I know it gets confusing. I'm probably not have to worry about it so much. So typically best practices, I set my ISO about 100 or 200. Right now I have all mine set at 100. Um, I have the ISO balanced with the flash power aperture, and we'll talk about that. But by keeping the ISO lower at around 100, you're going to get a clearer image. I have my shutter speed set at 125, so if I were to pick up my camera today, my ISO would be 100, my shutter speed would be at 125, and that just makes it so that my photos won't be blurry if I move my camera. Now the aperture settings are different. The aperture setting again is how big that lens opening, or how large the opening is that allows the light in the aperture. So the larger the number, remember it's 1 over 22 or 29, so it's actually a smaller number. That means it opens up to be smaller. It lets less light in. But the nice thing about with a smaller aperture or a higher number is that it gives you greater depth of field. And in just a second, I'll explain to you what that is. So in this photo, what you see is on the left-hand photo, you see the centrals, but the teeth towards the posterior part of the arch are blurry. That is because we are an f-stop of 4. On the right-hand side, everything else is the same. We just changed the f-stop. So now it's an f-stop at 32. But now you see that the centrals and the molars are clear. That's our depth of focus. So if the number is low, very shallow depth of focus, right? Centrals may be laterals. If the f-stop number is higher, now we have more depth of focus, so we get from anterior tooth back to posterior tooth. And that's all you have to remember. So when I'm taking like these intraoral photos, these are occlusal photos, I might shift the angle a little bit, but all of my intraoral photos are taken in a manual mode. So if you're using a DSLR or a camera that can be placed in manual mode, I've got my f-stop at 29 or 32 for the depth of field. I've got the shutter speed at 125 and the ISO set at 100. So these are the settings that you have to understand how to work with. And the key is the light. Depending on how much light you have, will depend on how you set your shutter speed, your ISO, your aperture. But again, when we do these presentations on photography, we have to kind of cover this just so you understand it. But I will tell you, just remember the system, and we'll go through it some more. So you saw that I have a ring flash. The ring flash is very good at taking intraorals because you don't get a lot of shadowing from the cheeks because the ring flash is kind of the size of the mouth, right? So light's coming straight in. If you have a 2-point flash, what that does, it gives you the ability to change where the illumination is coming in from, but the cheeks could get in the way, so you could get some shadowing, but it gives you a little bit more depth. And that's the nice thing about understanding the light. When it comes to camera bodies, like I was saying, you can get really, I don't know, you can get very complicated with fancy cameras. You can buy a $2,500, $3,000 camera that takes great photos and videos if that's where you want to go. But I just have a DSLR, and now there are mirrorless cameras, and I use it manual control for intraoral program when I take a portrait, and I use like a 100 millimeter lens. So I just keep it very simple. You can have retractors, mirrors, you can have different kinds of backgrounds. We can talk more about that later, but those are some of the accessories that can make a difference in your photography. Now, this photo I took just again with a typodont setup, but it has a black material in the back, and that creates more contrast. When you have more contrast, if these typodont teeth had any kind of translucency, that would stand out a little bit more on the incisal edges. But I can see the incisal contours better by having what we call a contraster behind the teeth. Sometimes I want to show the lab what the surface texture of the teeth are. So I will come in at a little bit of an angle, and you can see on that less central, you can see the mamelon effect there much better than when we had the straight on photo with right here, same type of dot. So sometimes I will come in straight on, but depending on what kind of flash I have, like if I have a ring flash, it'll unhook from the lens very easily. Just squeeze two clips, and I'll move the light source at different angles. So here I'm bringing the light source in from the typodont's right side or left side as we look at the photo. And as I took the photo, we got the shadowing to pick up some of the texture, and it makes a more dramatic effect. So when it comes to taking photos, some of the things to remember is prepare your patient so they know that you're going to be taking photos. Let them know that you don't want them swallowing or breathing too hard because your mirrors are going to fog up. You insert the retractors. A lot of times I will have the patient hold the retractors for me so that so I'm not overstretching them and they can kind of have control of that. Then what I'll do is I'll have them pull the retractors forward so it gets the lips away from the facial buccal surfaces of our teeth. If you're going to take a photo from the right hand side, they can pull the retractor back on the right hand side and relax them on the left hand side so they're not overstretching their lips. I think a big thing is just try to be consistent with how you want your photos to be framed, and then understand how to optimize the focus with your f-stop settings. So these are some of the photos that a lot of times we will ask our doctors to submit when they submit their cases. A portrait photo that's taken in the program mode. Everything else that's intraoral is taken in a manual mode that you see on the lower right hand side. And it's just settings. So you remember we had that triad. A lot of times I don't worry about the triad. I think it's good if you understand how the triad works. But all you have to know is the system and you're going to be fine. So when the patient first comes in, initial exam, we take a comprehensive number of photos. Then I use those photos to help me treatment plan and then educate the patients so hopefully they accept the treatment plan. And then as we're going through like lab photos, I'm monitoring the progress, maybe ortho's going on, and I'm using it for lab communication, ortho tracking, documentation. And then when I get to the end, it's really nice to take some final photos, whether it be the day that the treatment actually ends or maybe a month later, a couple months later, once the tissues have a chance to adjust and heal. So these photos are really integrated in my practice. I'm using my camera all day long. Again, I mentioned when I was in dental school over 40 years ago, I had my first uh, DSLR camera. No, it wasn't even DSLR because back then we had film. And so what I would do is I would take photos and drop it off to a photo lab and then have to go and pick them up. Today we don't have to worry about that. But I would take photos from initial exam, treatment planning, help track during the progress of our treatment, and then at the completion. So as you get into this, what you do is your team will understand you have this culture of photography, and it gets to be really fun. When the team knows you want to take photos or you want photos taken, it's even better. You, as a clinician, don't have to do all the photos. Your team knows how to do the photos. When we get our new patient exams, I step in the operatory and the radiographs are taken, our bioactive images are up on the screen, and I got intraoral and portrait photos already taken because my team does that. So take the time to educate your team on how to get the photos, figure out which photos you want, at least at the initial visit, and then you'll have this culture that just exudes excellence, right? Because patients will be able to understand what you're recommending better. There'll be greater trust there. Your dentistry is going to get better because it can't. If you're seeing the before and after results, it's hard not to get better. So maintain consistency in your protocol. Have standard images you want, lighting, figure out a systematic organization to your images. I don't do mine very well, but I just load my photos up at the end of the day according to the date. So if it's February 2nd, the photos I take today go in my file for February 2nd. So if Mrs. Smith had a crown and Mr. Jones had an implant and Dr. Mike had a composite, they're all in that day's file. But if I have to go back and find the documentation for that implant, I look at the patient's name, I look at the day that they're here, and I just go to that file and I can see their photos. And then, when it comes down to marketing and showing patients, don't, there's all kinds of filters out there. You can Photoshop things so it doesn't even look like it really did. But what we do is we don't alter the photos unless there's something wrong with the color, or maybe we didn't have enough light and the image was really dark, so we want to brighten up a little bit. But we're not going to mess mess with our images and make anything look better, right? Maybe we'll alter it so it's easier to see, but we're not going to alter what images are on that monitor. So some of the concerns is it's too time consuming. Well, really, like we've even timed it with our team. It only adds maybe 3 to 5 minutes at the new patient visit to capture all the images that are on our protocol. So it does go by very fast. So remember, if it takes us, say, 2 minutes longer to get the photos that you need, but it increases your case acceptance by 30%, I think that's time well spent. The basic training combined with the protocols that you develop, anyone could learn how to do that. You don't have to be artistic because all you do is just frame. You're not trying to get the mountains in the background or a fish jumping out of water. You just have a patient in front of you. You want to get in front of them. You want to center their centrals, let's say, and take that photo, or look at a lateral by centering their lateral incisors and taking a photo. And again, program for the portrait, program mode for the portraits, and manual mode for anything that's intraoral. And your team's going to get better and better and better at this, even if they're not artistic, right? You don't need to be artistic. You don't really even want to be artistic. You just want to have consistency in the images. So another concern is, well, the equipment is expensive. It is. It could be a couple $1,000s, as I mentioned even before. Or you could take your iPhone or whatever phone you have, get some lighting to support your iPhone, and they take very good images today. So it doesn't have to cost, a lot more. I really think the trouble that it takes to get the equipment, to train your team on how to get the photos really will pay the benefits. You're going to be able to diagnose better, because I tell my patients, I go, once I walk out the door, I may have some models, but I really forget what the color of the teeth were. And by being able to see it and the color of the gingiva, do they have gingivitis, do they have periodontitis, I can see that even better than by looking at their perio charting. And when they come back in, I can show them the photos. I can tie that together with the numbers and the perio charting that we got, or maybe there's oral cancer, hopefully not, but maybe there's something that we're concerned about. I can communicate that better with images. And if I have to dialogue with a colleague, I can send over some images and we can have a more intelligent conversation than me asking my colleague, hey, can you give me some advice? I've got a patient that has some worn teeth. What do I do? So the benefits are, I think, tremendous. So my call to action is if you started to watch this program and you weren't doing any photography in your practice, I hope you can see the benefits of it, how simple it can be to start taking photos. And the group I taught to, I was stressing to them that some of us want to not be contracted with insurance. We can help our patients by accepting their insurance, but we don't want to be contracted with their insurance. Well, why do a lot of us take insurance? Because the insurance actually helps to funnel patients into our practice. If at some point we decide not to be contracted with an insurance company, that funnel may get shut off. And then we have to do our own marketing. And one of the best ways to market is to have your own photos. Put those up on your website, put those in your posts, again, being HIPAA compliant. But the photos will make a tremendous difference in how your practice will grow. So invest in the training. You can take further workshops on photography you'd like to. There's even some great ones that I've seen online. Then what you do is develop your protocols. Which photos do you want to have when you do your treatment planning? Then train your team to get those photos so you no longer have to do every photo in the office. And then turn those photos into storytelling that will improve the outcome for the patient, that will ultimately grow your practice and elevate the standard of care. So let's say you've got a bicuspid and it's got a large MOD amalgam in it. And you take a photo of it because you start to see cracks radiating through the cusp tips or maybe straight mesiolingual. With those photos, you can don't just take a picture and put it up on the monitor and tell the patient, "Oh, you've got, whatever it is, you've got a crack in that tooth that goes from mesial distal, means nothing to the patient." But if you tell the patient, "See these dark lines that go from the front to the back of the tooth," that indicates that the tooth is starting to get weaker there because the cheek side and the tongue side of the tooth are starting to flex apart. And oftentimes I've had patients who've bitten down on food. It could be white bread, it could be a nut that's a little bit harder, and that tooth will actually split. And if that tooth splits and it splits way down, exposes a nerve, it's going to be very painful, and it splits and it breaks underneath the bone. Many times, all we can do is take that tooth out. I don't want that to happen to you. So what I recommend is, and then you explain to them whatever your treatment recommendation, whatever it may be. So it's going to make you a more effective case presenter, and it's going to make you a better clinician because then you're going to, let's say you do a crown on that tooth, you'll get a picture of the pre-op of the old amalgam restoration and the fractures. You'll get a post-op of the crown once you place it. You may look at that crown and say, "Wow, that looks great." Or you may look at it thinking, "Wow, you know what? I wish I had gone maybe a shade darker or lighter, or I wish I had had the lab put some craze lines in it, whatever it may be, or maybe some occlusal pit stain, or maybe not have the occlusal pit stain." But it's going to make you better because you can analyze your work. So anyway, just want to say thank you for your time. I really hope that you incorporate photography into your practice because I think it will be a practice builder, and I think it'll be very impactful to your practice today. If you aren't taking any photos and you start to take photos and you start to share those with your patients and you start to post those on your website or social media, it can't do anything but elevate your practice. It's going to enhance the patient care that you provide and really transform the way you communicate. And I think it's going to transform your practice. So thanks very much, and I will see you during our next program.